Good day, everyone. So our topic for now is the chemistry of respiration. So this topic will cover the structure and function of both hemoglobin and its molecular cousin, myoglobin. So for the outline, we shall first discuss the structure and function of hemoglobin. We shall also be discussing the different conformation of hemoglobin as well as its behavior when binding to oxygen. Then we'll proceed with the regulation of oxygen binding to hemoglobin. We'll have one clinical correlation to relate the structure of hemoglobin with one particular disease. And the last part of our lecture will be dealing with the structure and function of myoglobin. So let's go now to the overview of hemoglobin structure and function. So what is hemoglobin for? So we all know that it's an iron-bearing protein, which is the main component of the red blood cell. As a matter of fact, it is what gives the red blood cell its characteristic red color. What is the function of hemoglobin? Obviously, one of the major functions of hemoglobin is that it carries oxygen from lungs to tissues. But this is not the only function of hemoglobin. Hemoglobin also contributes to the removal of carbon dioxide from the peripheral tissue to be delivered to the lungs for excretion. However, hemoglobin is not necessary for the removal of carbon dioxide. Hemoglobin also has a buffering action. It is capable of maintaining blood pH as it changes from oxyhemoglobin to deoxyhemoglobin, as we'll be seeing in the latter part of our lecture. Where do we produce hemoglobin? Majority of hemoglobin is synthesized in the bone marrow at the stage of red blood cell development, where the cell is referred to as a polychromatophilic normoblast. What are the stimulants for hemoglobin synthesis? Hemoglobin synthesis is stimulated by tissue hypoxia. It is actually the hypoxia that causes the kidneys to increase production of erythropoietin, which increases red blood cell as well as hemoglobin production in the bone marrow. So what is now the normal ranges for hemoglobin? Well, females have lower levels of hemoglobin because they do lose blood every month. Whereas for male, the range is from 14 to 17 grams per DL. Females have a relatively lower value, ranging from 12 to 16 grams per DL. At birth, the level of hemoglobin should be from 13.5 to 20 grams per ml. So it has a wider range. And when the person reaches the early childhood years from 6 to 12, it now goes down to about 11.5 to 15.5 grams per ml. The type of hemoglobin actually changes all throughout a person's life. In the embryonic stage, the predominant hemoglobin is referred to as goer 1. So this is composed of 2 zeta and 2 epsilon subunits. But there are some variations too, such as goer 2, which is composed of 2 alpha and 2 epsilon subunit, as well as Portland, which is composed of 2 zeta and 2 gamma subunit. Now, when the embryo is now in the fetal stage, the predominant hemoglobin is known as the hemoglobin F, which has higher affinity to oxygen compared to adult hemoglobin. So this hemoglobin is composed of 2 alpha and 2 gamma subunit. Once the infant is born, the predominant hemoglobin now is hemoglobin A, the type of hemoglobin that we shall be discussing today. So this type of hemoglobin is composed of 2 alpha and 2 beta subunits. However, there are small amounts of circulating hemoglobin that is composed of 2 alpha and 2 delta subunits. So this only makes about 4% of circulating hemoglobin. And some fetal hemoglobin would still persist, but they are almost negligible at 1%. So as always, this fetal hemoglobin is composed of 2 alpha and 2 gamma subunits. So in the embryonic stage, the hemoglobin is actually produced by the yolk sac. The level of embryonic hemoglobin starts to drop eventually, and by 3 months, it is totally replaced by fetal hemoglobin, which is produced by the liver. Now, the bone marrow, which produces adult hemoglobin, starts producing about 3 months post-conception, but it rapidly rises 9 months and eventually is the predominant hemoglobin at birth. So let's move on now to the synthesis of hemoglobin. So heme and globin are produced at 2 different sites in the cell. Heme is produced in the mitochondria as well as in the cytoplasm of the polychromatophilic erythroblast, whereas globin, since it is a protein, is translated in a polyribosome within the same cell. These 2 separate processes are well synchronized, as illustrated here. So let's imagine this as a polychromatophilic erythroblast within the bone marrow. So those iron, which can be transported inside the cell, will be utilized for the synthesis of heme. Within the mitochondria, glycine as well as succinyl-CoA will condense to form ALA, delta amino levolonic acid, as catalyzed by the enzyme delta aminolevolonic acid synthase, the regulatory enzyme in heme biosynthesis. This is eventually exported out into the cytoplasm where 2 ALAs condense together to form porphobilinogen. And 4 porphobilinogen will be condensed together to form uroporphyrinogen. At this point, there will be modification of the side chain to produce coproporphyrinogen, and eventually this is translocated back into the mitochondria where it is converted into protoporphyrin. And the final step is the incorporation of the ferrous ion, and what you have now is heme. Meanwhile, in the ribosome, the alpha and the beta chains are being translated, and eventually it will combine with the heme to form now hemoglobin. So recapping the structure of hemoglobin, so we know that erythrocytes are the carriers of hemoglobin. As a matter of fact, each RBC contains about 280 million hemoglobin molecules. Now we all know that a mature red blood cell lacks nucleus and other organelles in order to maximize the amount of hemoglobin that can be contained within each cell. Now, since each RBC contains about 280 million hemoglobin molecule, and each hemoglobin is capable of carrying 4 oxygen molecules, so, we can say that each RBC is capable of carrying about 1 billion oxygen molecules. So let's move on now to the structure of hemoglobin. So hemoglobin is a polypeptide composed of 4 subunits. So the highest level of protein structure that it can demonstrate is the quaternary level of structure. So it's composed of a globin chain, 2 alpha chains, and 2 beta chains, as well as the prosthetic group, the heme, which is a porphyrin ring, and at the center you will find the iron. So in this ribbon model, we can see that it is composed of 2 alpha subunits and 2 beta subunits. And tucked in the hydrophobic crevice of each polypeptide is the heme. So there are 4 hemes for every molecule of hemoglobin. So each subunit of hemoglobin or myoglobin contains a prosthetic group, the heme. And the heme, of course, is the one that binds one molecule of oxygen. So we all know that heme is a heterocyclic porphyrin derivatives, specifically protoporphyrin. So it's composed of um, the ring. We call this the protoporphyrin ring. In the center, you have iron in the ferrous state. And the iron is actually capable of forming ligands, or it binds with an amino acid, histidine, which is part of the subunit, the polypeptide subunit. Whereas iron, or the ferrous, is also capable of forming ligand with oxygen. So what are the forces now that stabilizes the quaternary level of structure of hemoglobin? This would include hydrophobic interaction, hydrogen bonding, as well as ionic interaction, or as we shall be referring in this lecture, the salt bridges. To illustrate, hemoglobin is a tetramer, but we can envision it as being composed of two identical dimers. The first dimer is an alpha-1, beta-1 dimer, and the second dimer, of course, is the alpha-2, beta-2 dimer. So we can think of this tetramer more accurately as a dimer of two dimers. So each dimer are tightly held together primarily by hydrophobic interactions. And the two dimers are able to move with respect to each other and are being held together primarily by polar bonds or ionic bonds, as illustrated in this schematic diagram. So the two dimers are held together by hydrophobic bonds. So alpha-1, beta-1 subunits are held together by hydrophobic bonds. The same would be true for alpha-2, beta-2 subunit. Now this dimer is connected to the other dimer by ionic bonds, or what we refer to as the salt bridges in this lecture. Now take note, however, that the amount of ionic bonds vary according to the state of hemoglobin. In the R state, or the relaxed state, there are less ionic bonds, whereas in the taut state of hemoglobin, there are more ionic bonds. Let's move on now to the conformation of hemoglobin, as well as its behavior during oxygen binding. So hemoglobin actually has two conformational states. The first one is referred to as the relaxed state, or the state that is favored when hemoglobin is oxygenated, whereas the other one is called the taut state, the state that is favored when hemoglobin is in the deoxygenated state. Before we go there, let's have a bit of a fairy tale. Once upon a time, in a magical kingdom, there was an orchard that bears a lot of oranges. A truck would come in and gather those oranges. Now, eventually, the truck would travel into a barren land. And that land doesn't have any plants, it doesn't have any fruits, and the people are too lazy to produce. They are totally dependent on the magical orchard for those fruits. The truck would go there and eventually dump those magical fruits for the villagers to consume. Eventually, the truck goes away and goes back into the magical orchard to gather more fruits for the barren villagers to consume. We can actually quantify this. On the x-axis, we can put there the amount of available fruits. Whereas on the y-axis, we can take a look at the amount of fruits contained by the truck. In the magical orchard, where there's a lot of available fruits, the truck is filled to the brim. But on the barren village where there are no fruits, the truck is now practically empty because it has unloaded its content. we can change the amount of available fruits to the amount of available oxygen as expressed by the partial pressure of oxygen. Whereas the fruits in the trough is actually analogous to the saturation of hemoglobin. The orchard refers to the lungs, and the barren village refers to the tissue. In the lungs, where there's a lot of available oxygen, hemoglobin is almost 100% saturated. But when hemoglobin travels into the peripheral tissue, where the partial pressure is somewhere between 20 to 40, the saturation of hemoglobin suddenly drops. In other words, hemoglobin is now suddenly unloading its content. That's why the saturation for hemoglobin drops. Now, going through the reverse process, when hemoglobin goes back into the lungs where there is a lot of available oxygen, hemoglobin is again once more suddenly saturated with oxygen. So this is what we refer to as the oxygen-hemoglobin dissociation curve. So it seems like hemoglobin is responding to certain signals that allows it to take up oxygen when there's a lot of oxygen. And it is also capable of unloading oxygen when there is a need for oxygen in the peripheral tissue. So there must be some regulators in oxygen-hemoglobin binding. So before we go there, let's briefly discuss first the concept of cooperative binding. So the binding of oxygen to hemoglobin makes it easier for more oxygen to bind. So in other words, when one oxygen molecule is now bound to one subunit of the polypeptide hemoglobin, the rest of the oxygen molecules would suddenly bind to oxygen. So this cooperative binding is actually visible when hemoglobin now travels into the lungs. So oxygen binding increases the affinity of hemoglobin for oxygen. Cooperative binding is possible because hemoglobin is composed of 4 subunits linked together, which can change conformation. So like what we have said earlier, there are 2 conformational states for hemoglobin. The taut state, which contains more ionic bonds, and the relaxed state, which contains less ionic bonds. The taut state is favored when there is low oxygen, when there's low level amounts of oxygen, whereas the relaxed state is favored in the oxygenated state. So let's demonstrate now cooperative binding. So let's imagine hemoglobin on the taut state traveling to the lungs where it will encounter oxygen molecule. So the first binding is not easy because the taut state has low affinity to oxygen. But that information of binding is now transmitted to other subunits so that there would now be easier binding for the second subunit. The third subunit would bind easier, and the final subunit would bind to the oxygen easiest. So this is what is referred to as cooperative binding. It also, of course, can be reversed when oxygen now dissociates from hemoglobin when it has reached the peripheral tissue, restoring now hemoglobin into the taut state. So like what we have said earlier, hemoglobin has 2 states. The taut state, which is favored in the deoxygenated state, and the R state, which is favored in the oxygenated state. So in cooperative binding, deoxyhemoglobin is relatively uninterested in oxygen. But when one oxygen attaches, the second binding becomes easy, the third and fourth easier. So cooperativity indicates that one hemoglobin subunit transmits information to the other subunits. So in order for us to understand how that information is transmitted to the other subunits of hemoglobin, Let's take a look at how oxygen affects the conformation of the protoporphyrin ring. So to recap, the heme has iron in its center, and the iron is capable of forming ligand with proximal histidine, part of the polypeptide subunit. Iron is also capable of forming ligand with oxygen, and oxygen eventually links the iron to the nitrogen of the distal histidine, part of the same polypeptide subunit. Now, if we take a look at the conformation of the protoporphyrin ring in the deoxygenated state, if you notice, the porphyrin ring itself is not flat or planar. It is because the iron is slightly off plane. Hindi siya nasa gitna. But when oxygen binds to iron, we can all of a sudden see that the iron now goes into the very center of the plane. Since it moves into the center, the histidine is also pulled up along with the iron ring. So this, of course, represents the oxygen molecule. What is the explanation for that? For the conformational change in the porphyrin ring. So the ferrous state, when it binds to oxygen, the iron loses much of the electron cloud because oxygen is highly electronegative. So the iron loses much of the electron cloud because most of the electron would now move towards the oxygen. So oxygen would form a superoxide ion. Since the iron loses much of the electron cloud, its diameter is now much, much smaller. This is the illustration of what I'm talking about, of how the iron affects the transition from the taut to the relaxed state. So let's imagine this as one subunit in the polypeptide. And this is, of course, the proximal histidine, one of the histidine subunits, and this is the other histidine subunit, and this is the porphyrin ring, iron, slightly off center. So when oxygen binds to the iron, it links the histidine with the iron. And since oxygen is highly electronegative, most of the electron cloud would now shift to oxygen. As a result, the iron becomes very thin. It now moves into the center of the porphyrin ring. Since iron is linked to one of the histidine, which is linked into the polypeptide, that movement is transmitted into the rest of the polypeptide. How will that now affect the conformation of hemoglobin? Let's take a look at the entire tetramer. So let's imagine that this is in the taut state where there are more ionic bonds between the two dimers. Oxygen binds to the iron. Iron changes conformation. It becomes thinner. And as such, because it's thin, it is now capable of moving into the plane of the porphyrin ring, pulling along with it the polypeptide. Since the polypeptide are now moving away from each other, the ionic bonds are also dissolved. Now remember, ionic bond is because of opposite charges, and those charges would only be attracting each other when they are close. When they are moved far apart, it no longer works. So what you have now is the relaxed state, which contains less ionic bonds. So to recap what I have said, without oxygen, the ferrous ion is out of the porphyrin ring plane. The covalent radii of the ferrous ion is too large to fit into the cavity created by the 4 nitrogen atoms of the porphyrin ring. With binding of oxygen, the formation of low spin ferrous, or the ferric state, the radii of the ion decreases. Iron now moves closer to the heme cavity. The movement causes breakage of ionic bonds between dimer, and the protein is now in a comparatively less strained state, or the relaxed state. Let's compare now the two states of hemoglobin, the two conformational states. So first we have the relaxed state, or the oxyhemoglobin conformation. So this contains less interdimer ionic bonds. In terms of behavior, this has higher affinity for oxygen. This is the preferred configuration. It is also the more stable configuration. In contrast, when hemoglobin is in the deoxygenated state, it is now on the taut state. It contains more interdimer ionic bonds and it has lesser oxygen affinity. In contrast to the relaxed state, this is less preferred. The taut state is less preferred. It is less stable. However, it is preferred only under certain conditions, such as low pH or high hydrogen ion concentration, high 2,3-BPG concentration, and high temperature. All these conditions are the conditions that are present in the peripheral tissue. Now, to describe the transition from taut to relaxed state, there are two models that are used, the concerted model and the sequential model. Both models have assumptions and limitations, so each one complements each other. So the first model is the concerted model. Here, the assumption is that hemoglobin can only exist in two conformations, the taut state and in the relaxed state. Now, the driving force which allows the hemoglobin to transition from taut to relax is the amount of oxygen. So when oxygen level is high, the equilibrium is shifted towards the formation of the relaxed state. However, when oxygen tension is low, the equilibrium is favored towards the formation of the taut state. So in this model, the assumption is that hemoglobin only exists as either one of the two states, the taut state or the relaxed state. So there are no in-between states. So the binding of an oxygen molecule to hemoglobin will simply shift the equilibrium between these two states. So as illustrated and as what is stated earlier, there are only two states to reiterate, the taut state and the relaxed state. And the amount of hemoglobin actually favors, shifts the equilibrium. So when there's a lot of oxygen, we shift the equilibrium towards the formation of the relaxed state. Whereas when there's less oxygen, we shift the equilibrium towards the taut state. What is the limitation now of this particular model? It does not describe how hemoglobin changes its shape upon oxygen binding, how this change in conformation leads to adjacent unoccupied heme groups to increase their affinity to oxygen. And this is where the other model comes in, the sequential model. So as you can see here, there are intermediate states between the taut state and the relaxed state. So the assumption is that hemoglobin exists in several states. There are three intermediate states that separate the taut state from the relaxed state, as shown here. Binding of oxygen changes that subunit shape and also alters the nearby subunit, which in turn changes their affinity for oxygen. However, there is a limitation to this model as well. So hemoglobin will only exist on the R state, when all four oxygen molecules are bound to the 4-heme group. This is, of course, is not what is observed in nature. So in nature, we can also see the relaxed state, even if only few oxygen molecules are bound to it. So as we have said earlier, both the sequential model and the concerted model have limitations, and thus they complement each other. So now let's move on to the regulation of oxygen binding to hemoglobin. So what are the allosteric regulators of hemoglobin? This answers the question, how does hemoglobin know when to take up and when to release oxygen? So what are those possible allosteric regulators? As we have seen in the cooperative binding model, in the lungs, the allosteric regulator is oxygen itself. But in the peripheral tissue, the regulators are the concentration of BPG, the pH, carbon dioxide concentration, as well as temperature. Let's take a look at what is the effect of 2,3-BPG on hemoglobin. So let's say that hemoglobin is in the taut state now. It travels into the lungs where there's a lot of oxygen. It binds to the hemoglobin molecule, transitioning now the taut state to the relaxed state. Now this oxygenated hemoglobin travels into the peripheral tissue so that those oxygen molecules can be delivered. So in the peripheral tissue, the oxygen is released. However, there is a possibility that those oxygen molecules can go back to hemoglobin, but that does not happen. And what is the reason for that? 2,3-BPG clings to the pocket formed at the very center of the hemoglobin tetramer. 2,3-BPG locks hemoglobin into the taut state. Since it is now locked into the taut state by binding of 2,3-BPG, oxygen cannot bind to the heme prosthetic functional group. This in turn leads to the efficient release of oxygen so that it can be utilized by the cell. So to recap, what are the effects now of 2,3-BPG on hemoglobin? As you have seen in the simple cartoon, BPG binds to the center pocket in hemoglobin, stabilizing the taut state. In the taut state, there's a reduction in hemoglobin's affinity for oxygen. So this allows hemoglobin to act as an effective oxygen carrier, unloading about 66% of oxygen to exercising tissue. So where does 2,3-BPG come from? So in actively metabolizing cell, glycolysis is very active. When it is very active, part of the side products of glycolysis is 2,3-BPG, which eventually will be isomerized back to 3-phosphoglycerate. So anyway, 2,3-BPG is produced by actively metabolizing cells, cells that require a lot of oxygen. What about the effect of pH and carbon dioxide concentration? Carbon dioxide binds covalently to the N-terminus of the polypeptide. As it binds to the N-terminus, carbon dioxide and the N-terminus forms a negatively charged carbamate. And this negatively charged carbamate forms ionic bond with arginine, which means more ionic bond favors the taut state. So low pH and high carbon dioxide concentration favors the taut state. pH in turn also protonates the basic side chain, such as histidine. Since histidine is protonated, it is now positively charged and can now form ionic bonds with aspartic acid. So again, more ionic bonds means it favors the taut state, less affinity for oxygen. Now this is actually illustrated in the Bohr effect, the effect of pH and carbon dioxide concentration in peripheral tissue. So the Bohr effect refers to the observation that increases in the carbon dioxide partial pressure of blood or decreases in blood pH results in lower affinity of hemoglobin for oxygen, as illustrated here. So actively metabolizing cell produces a lot of carbon dioxide in tissue, which diffuses into the plasma. In the red blood cell, carbon dioxide forms carbonic acid. So the bicarbonate is exchanged with chloride. We call it the chloride shift, whereas the hydrogen ion, the proton, combines with hemoglobin. So when it combines with hemoglobin, as we have seen earlier, the relaxed state is transitioned to the taut state, which has less affinity for oxygen, allowing oxygen to be released and delivered into the actively metabolizing cell. So let's move on now to one clinical correlation, threat to hemoglobin. So there's only one for this lecture, and that is sickle cell anemia. So this is a recessive genetic disorder. So this is due to a mutation in hemoglobin B gene, which is the result of change, a point mutation from A to T. So the original codon codes for glutamic acid. It now codes for valine because of that point mutation. So if you remember, glutamic acid is acidic charge, negatively charged amino acid. So this amino acid should be located on the surface of the polypeptide, whereas valine is hydrophobic amino acid. Because of the change now in the amino acid, hemoglobin, the sickled hemoglobin behaves very differently from regular hemoglobin. And what is the difference in terms of behavior? The sickled hemoglobin polymerizes under low oxygen tension, and this polymerization distorts the shape of the red blood cell. So to illustrate, let's go to a normal hemoglobin first. So when in the deoxygenated state, a hemoglobin molecule forms a pocket. This is a normal event, and it is of no consequence. However, in the sickled state, because of the change now in the amino acid sequence, it forms a sticky patch right here. So when in the deoxygenated state, a pocket is formed, plus you have a sticky patch. What will be the consequence of that? So let's say that hemoglobin, sickled hemoglobin, is still on the arteries, which have high oxygen tension, and then it travels to capillaries where the oxygen tension is eventually very low. A pocket is formed. That sticky patch and that pocket can stick together, forming now a polymer. So more and more hemoglobin molecules sticks to one another, forming a polymer that is very large and can ultimately distort the shape of the red blood cell. Why is the sickled red blood cell not an advantageous shape? Now remember, a healthy red blood cell is biconcave in shape, and its size is about 5 microns in diameter. Some capillaries are 3 microns in diameter. So how can a red blood cell that is 5 microns in diameter able to pass through tiny capillaries? Well, the biconcave shape gives the red blood cell its flexibility. It is capable of distorting its shape to allow passage through tiny capillary. That flexibility is lost when the red blood cell now assumes a sickle shape. And thus, those sickled cell will now block capillaries, resulting to microinfarctions. So all the symptoms are actually the result of occlusion of blood vessels of capillaries. So this includes pain episodes, stroke, increased infection rate, leg ulcer, bone damage, jaundice, hemolysis that results to increased levels of bilirubin, resulting to formation of gallstone. Because of hemolysis, there would be eventually low red blood cell count. And capillaries would be blocked, so there would be lung blockade, kidney damage, priapism, as well as eye damage. So the symptoms actually vary considerably from person to person. So the pain develops when the sickle-shaped red blood cell blocks the flow of blood to the chest, abdomen, and joints. And the sickle cell crisis can last anywhere from a few minutes to several months. So now let's move on to the structure and function of myoglobin. So myoglobin is much simpler than hemoglobin. As a matter of fact, it's a single polypeptide chain composed of 153 amino acid residue. So it's a monomer. There's only one subunit, which consists of alpha helices and beta sheets, which are stabilized by hydrogen bond. It's actually very similar in terms of the tertiary structure to the beta subunit of hemoglobin. The function of hemoglobin, of course, is that it stores oxygen, and there is an abundance of myoglobin in both heart and skeletal muscle. So the ribbon model for myoglobin is shown here. So it's composed predominantly of alpha helices, and in the hydrophobic Cresvis, you will find there one heme prosthetic group, which is the binding site for oxygen. So since myoglobin is a monomer, myoglobin can bind to only one molecule of oxygen because it only contains one heme group. Oxygen dissociation curve for myoglobin is hyperbolic since it does not exhibit cooperativity. So it means that hemoglobin has high affinity for oxygen at all partial pressures of oxygen. So let's compare now the dissociation curve of hemoglobin versus that of myoglobin. So hemoglobin is shown in blue, myoglobin is shown in red. So for hemoglobin, you can see that it is fully saturated when the partial pressure of oxygen is very high. But then the saturation of hemoglobin suddenly drops when the partial pressure is somewhere between 20 to 40, the average partial pressure in peripheral tissue, because at this point, hemoglobin is already giving up its oxygen. Let's take a look at myoglobin at this particular partial pressure. It's still clinging on to its oxygen molecule. It doesn't give up its oxygen molecule at the average partial pressure of 20 to 40. It will only give up its oxygen when the partial pressure now dips to below 15. So at below 15 of partial pressure of oxygen, there's a drop in the saturation of myoglobin. That's the only time that myoglobin is giving up its oxygen. So we say it is for the storage of oxygen because it doesn't give up its oxygen under normal circumstances. Only when the partial pressure drops to 15 is the time it would give up its oxygen. So at high concentrations of myoglobin in muscle cells allow organisms to hold their breaths longer. So there's a lot of myoglobin in deep sea organisms like, say, whale and dolphins. Oxygen binds to myoglobin and is released only when the hemoglobin can no longer supply adequate oxygen molecules to muscle cell. What about the role of myoglobin in diseases? Myoglobin is released from damaged muscle cell. We call it rhabdomyolysis. So the released myoglobin is filtered by the kidneys, but it is toxic to the renal tubular epithelium, and this may cause acute renal failure. And this is one of the causes of deaths for persons who are subjected to hazing. So the rupture of muscles there releases myoglobin, which eventually would be filtered by the kidney and would be toxic to the renal tubular epithelium. So the most common cause of death for patients who are subjected to severe hazing is acute renal failure. So let's summarize what we have discussed today, the key points to remember. Hemoglobin is composed of two alpha beta dimers, so it is best described as a dimer of a dimer. Heme is the prosthetic group that binds to oxygen. Hemoglobin, because it's a tetramer or a dimer of a dimer, exhibits cooperative binding and switches between the taut to the relaxed state depending on oxygen concentration. R state is favored, but the R to the taut state switch is facilitated by the following conditions: high 2,3 BPG concentration, high hydrogen ion concentration or low pH, as well as high temperature and high carbon dioxide concentration. Myoglobin is a monomer. Since it is a monomer, it does not exhibit cooperative binding. It functions to store oxygen. And that's the end for this particular lecture. Thank you for listening.